I appreciate my colleague across the aisle's remarks, but I think, with all due respect, you're missing the mark entirely. You're missing the mark entirely. Our country—
Well, not entirely.
Our country is sick.
What you're about to witness is stark differences in how Democratic and Republican congresspeople approach the issue of mega corporations squeezing every last red cent out of the American people.
Our country is sick. Why is Europe and Canada paying less? Because they don't have an enormous obesity problem, because half of them don't have diabetes. I mean, all of these are preventable diseases. They're all preventable diseases. Mr. Joyner, what % of the drugs that you sell treat trauma injuries of some kind, or genetic abnormalities? What %? 10, 15% of the drugs you sell?
I'm not sure.
I bet it's less than 20. We can all agree. So everything else is purely preventable.
Without citing evidence and without an answer from the witness, Timmons just runs with his own number to continue crafting the narrative that the American people are responsible for pharmaceutical and healthcare companies gouging us wherever they can.
I mean, so we have all of these problems with drug prices, but we have a demand issue. We have a demand issue. This country is sick. I have seen more people getting dialysis in the last 6 years. I go to these dialysis clinics at least once a year, and it's sad. And there's more of them, and there's more of them. And 95% of people that have diabetes that need insulin can exercise and eat better and not have these problems. So we're here to talk about who is making more money along the supply chain. Why don't we cut the supply chain off? Cut the need off. People need to be healthier. They need to take responsibility for their health. They need to exercise. They need to eat right. Our entire healthcare system delays death and treats sickness. We do nothing to facilitate health and wellness.
And this is how Republicans get away with the constant lying and moving the goalposts regarding issues they cannot defend. Yes, Timmons is correct in saying that we do need to focus more on preventative medicine, along with improving fitness and nutrition quality. But do you notice how he just completely absolves blame from any other factor responsible for our levels of diabetes and obesity, food deserts, poverty, working multiple jobs, corporate greed, pollution, deregulation, housing prices, and countless other factors? They all contribute to the problem far more than an individual's personal choices. But for so many conservatives, it's all boiling down to the usual, the classic personal responsibility scapegoat.
We talk about Europe. I mean, their diabetes rate is drastically less. So yeah, insulin's less. There's less demand. And the cost of insulin goes up because millions and millions of Americans are increasing the demand on it. 129 million people in this country have at least one major chronic disease. At least one major chronic disease. Heart disease, cancer, diabetes, obesity, hypertension are the lead. All of those are very preventable unless you have a genetic abnormality. I'll even use my Excel as an example. I owned a CrossFit gym. I worked out every day, and I went to the doctor. I got some blood work done, and the blood work came back. She said, "William, you have a cholesterol problem." I said, "I'm 10% body fat. I work out every day. What's up?" And she said, "Well, what do you eat?" At the time, I was eating probably 16 ounces of steak a day. She was like, "Well, there's your problem." So I reluctantly changed my diet. I ate some fish, had some shrimp, ate some chicken, go back, get my blood work done, not a problem. Could I, without any penalty, have continued eating 16 ounces of steak every day and gotten a pill, lived on that pill for the rest of my life, and received no additional cost to me as a person? Yeah, I could. That's our healthcare system. There's no accountability. And you know what's crazy? That cholesterol pill that I take after a couple years, I'm probably gonna get a blood pressure issue. So there's a pill for that. And let's just say I stop exercising, gain weight. There's a shot for that. I mean, this is not how our country needs to be operating. It's just outrageous.
Timmons doesn't understand that the vast majority of Americans don't have the luxury of time to spend at the gym, nor the funds to consistently eat nutrient-rich food like he did. This anecdote example is, well, nothing but political theater. It does nothing to aid the substance of his faulty argument.
The way to address our healthcare system is by accountability, personal responsibility. We have to incentivize health and wellness and not delay death and treat sickness. So I realize I'm on my soapbox here, but We have a major problem in this country. We have some of the worst outcomes of any developed country, and we spend 4 times more. Average spending, almost $5 trillion? And we have one of the least healthy developed population in the world. So I get it. We're fighting over drug prices, who along the supply chain is getting what and how they're doing that. We have to go to the root cause. We have to reduce the demand for all of these drugs. Even the military is having a huge problem. We're having to constantly reduce our standards because we cannot field a professional military. This is a national security threat. We have $35 trillion in debt. We're adding $1 trillion to our debt every 100 days. And we have workforce issues because people are unable to work because they're at the dialysis clinic or they're too sick. And again, 90% of all of this is preventable with diet and exercise. So I understand that we're fighting over drug prices and who along the supply chain, but we got to go to the root cause, and we have to get serious about incentivizing health and wellness and stop fighting over who gets what dollar as we delay death and treat sickness. And with that,
would the gentleman yield for a question?
Absolutely.
But I'm very drawn by your analysis, but would you take it one step further and say that Congress and the federal government should not be investing in big sugar, in big dairy, and in unhealthy agriculture practices that end up producing diabetes and unhealthy outcomes?
I do everything in my power to eat things that are from nature, and I'll leave it at that.
All right.
Nothing happens in a vacuum. Capitalism, specifically the monopolies and oligopolies we have in this country, are the main culprits for the healthcare crisis and the related massive drug price crisis. And the lack of real investment in overall health and wellness of the American people, that's where the actual crisis begins. A properly run single-payer Medicare for all system would certainly help massively quell the price gouging and price fixing. Can you imagine a country where the poor and elderly don't have to make an agonizing decision like choosing food over medicine or housing and utilities over a desperately needed visit to the doctor? Solving this crisis would also do something else. It would incentivize further innovation, research, development, and it would do what Big Pharma has worked tirelessly against. It would increase market competition.
You bring a couple million, 8, 10, 12 million people into this country, and you lure them with social safety net programs, you lure them with government benefits, and they go to the blue states. They go to the cities that offer wildly disproportionate social benefits to those in need.
Leave it to MAGA to openly admit that providing care to people in need is a bad thing. But we're just getting started with William Timmons.
They're going there, and I guess when the census occurs, it's going to result in New York and California and Illinois receiving a disproportionate percent of their representation because we do not apportion the census based off of citizens. We apportion the census based off of humans. And I think that's a big problem. The amount of human misery occurring in this country because of the lawlessness at our southern border is just shocking. It seems like he's destroying the American dream. They're not safe. The defund the police movement has resulted in enormous violence and insecurity in our cities. And our country's just on the wrong track. And we really need to change course.
Now that Timmons is done hiding his bigotry behind this fake persona of actually caring for the American people and wanting to restore the myth of the American dream, let's hear Texas progressive Jasmine Crockett's response to the absolutely fear-mongering rant.
I do want to address the last things that were brought up about the census, and I'm not really sure if my colleague recognizes that Texas actually got 2 new congressional seats. The state of Texas actually grew a whopping 4 million people, and because of those 4 million people that came into Texas, or from wherever they came from, we actually got 2 new congressional seats, which Texas historically has been a red state, and New York actually lost a seat, which historically has been a blue state. So I did want to make sure we put some facts on the record.
Crockett does a masterful job in debunking Timmons' depiction of the Great Replacement theory, while simultaneously shooting down the idea that the census should only count citizens and no one else. And look, she's far from done. Believe that.
In fact, there's a lot of anti-immigrant rhetoric and blaming of immigrants when certain things happen. And based on things coming out of this committee, we seem to believe that immigrants are the reason why crime is up and why our communities are less safe. So I did my research, and I want to go through some of it with you. Sheriff, do you know if within the last year between 2022 and 2023, if there was an increase or decrease in murder and negligent homicide in Tarrant County?
I don't have the numbers in front of me, but it did not increase.
Okay. In fact, it went down by almost 17%. So great job. What about manslaughter by negligence, or we call it criminally negligent homicide?
I believe it also went down.
Yes.
In the past, it may be on ticking up at the moment on intoxicated and homicide may be ticking up at the moment in 24.
Okay. Well, we had a 56.52% decrease. How about rape?
All those categories we believe went down.
Absolutely. So there actually was a decrease by 3.35% in rape. Robbery went down 4.5%, and both aggravated and simple assault went collectively down by 3.18%, and theft went down by 3.89%. This is at the same time in which we're talking about the migrant community and stoking these fears that they're bringing all of this trauma and this crime and violence to our communities. But when we look at a Texas community, Tarrant County, actually everything has gone down. And I do want to thank you for your service in that way, because it takes a team. It can't just be one thing. It means we've got to have great law enforcement, but we also have to have really good policies. And we honestly need to be honest about the data that we see.